session of the LASEA. Thank you, got it. Welcome to the LASEA Labor Network session. We have 4 great papers and 4 fantastic speakers. We have Marcela Slava presenting first, then we will have Nora Lustig presenting her paper, Fernando Saltiel, and then Juliet Santamaria will be the last presenter. So the rules are, the usual. Marcela, you have 20 minutes for your presentation. I will let you know 5 minutes in advance when your time ends. People can participate in the presentation through the chat or raise your hand, and we can allow you to ask your question. All right. So thank you again for coming, Marcela. The screen is yours.
Great, thank you. Well, thank you so much for having me in this session on inequality and COVID in Latin America. The paper I'm going to present is joint work with Laura Alfaro and Oscar Becerra. It started back in like April 2020, so in the middle of the craziness. And its motivation at that point was one, but I think exposed, these has become even more important, as illustrated. Oh goodness, now here it goes. As illustrated by, I think, what exposed outcomes show us. This is a picture from an ILO monitor report showing the loss in working hours in different countries in 2020 relative to the fourth quarter of 2019. And as you can see, Latin America, and in particular South America, is there very dark. The other countries that are as dark are other emerging market economies that share with Latin America interesting features of the labor market. And so that motivated us to try to think why, or in the start, we were thinking what makes our countries different and what things should worry us. One obvious response is high informality. And from the work I've been doing for years, this is very closely tied to a characteristic also of the productive sector, and it is the amazing prevalence of micro enterprises in the amount of labor that they absorb. If you think, for instance, of the manufacturing sector, whereas in Latin America, close to 35% of workers in the manufacturing sector are in these micro enterprises, businesses of 10 or less workers, that number is only 4% in the US, and is also very low in all other developed economies. And that brings with the other characteristics or attributes of jobs in employees that are important for responses to crisis and how we react to them. Low organizational capital is one characteristic of firms of this type, and of course, greater flexibility in informality. I seem to have, well, it doesn't matter. The other characteristic of both micro enterprises and people in the informal sector or labor informality is that they work with weaker cash flows and weak access to financing than formal firms and jobs. And all those characteristics make them more vulnerable as a crisis hit, but they also may make them easier to recover. Firms and workers in our countries also have a lower capability for working at home, which is, of course, a crucial attribute in COVID times. And if we think about the policy responses in our countries, on top of these vulnerabilities, some countries in the region implemented long-lasting blanket lockdown measures that in the beginning in our continent lasted for as long as 6 months. Here just an illustration of what I just said. We don't even have information for informality in the US. The databases are registry information because you can trust that. Informality is so low that you're not even worried about it. And if you look at the numbers, as I mentioned, of employees in firms that are less than 10 employees, you will find that the numbers are much larger in Latin America. Here, for all the sectors, I talked before about the numbers for the manufacturing sector. Self-employment is a big part of both informality and small firm employment. Here we're counting as one-person firms, the self-employed, and the numbers of people who can work remotely. This is our own calculation based on the Dingle and Newman strategy, is lower also in our region. One advantage that we did have is that we have more concentration in essential sectors, which were less hit as compared to the US. Here an illustration of these greater stringency of some of the measures in some of our countries. You can also see that, for instance, Mexico has low stringency as compared to the benchmark here, which is the US. If you look at the x-axis, you will see that these harsh controls are very long lasting from the start of the crisis to the 1st of September. The timing is similar in Peru, and it lasted for even longer in Argentina. So with that picture, what we aimed to do in this paper at the beginning was basically to develop a diagnostic tool that could help governments assess their country's vulnerability in terms of the labor market, and try to design responses that were consistent with that vulnerability. To that extent, we lay out a model that allows us a very simply implementable model to assess these what I call excess vulnerability as compared to countries in the advanced world that do not have the same vulnerabilities of both employment and household income in our countries, in particular in Latin America, focusing on this differential distribution of workers across sectors, from size categories, etc. Our model features in terms of shocks associated to COVID, supply and demand shocks associated to the event, but also propagation through IO linkages. Of course, if this is a tool that, in terms of its ability to incorporate this differential distribution of workers, could serve for purposes other than COVID, as long as you adopt the accounting of the shocks to the whatever crisis is it that you're talking about. This is a probabilistic framework. We apply it to Colombia, which is similar to employment distribution. I'll show results for Peru that show robustness, and we also run an ex post analysis now that we have actual data for what happened over that period in 2020 of how our model fit. I'm not going to talk about how we fit within the literature unless I have time at the end. Let me give you a preview of the results. In a scenario where we combine blanket overall lockdowns of all non-essential activities with idiosyncratic demand losses that are specific to the sectors, we find that in Colombia, and also, as I said, in Peru, 50% of jobs and 30% of value added were at risk under the Colombian structure. What do I mean by at risk? It's basically how many jobs would be lost if there were no government responses, and of course, if there are other shocks that I'm not measuring in the model. The difference with respect to the US, where the numbers are 8% rather than 50% and 3.7% rather than 30% in that baseline scenario that we have for, think of this as, say, the second quarter of 2020. The difference between the Colombian structure and the US structure for the same set of data is explained by precisely informality and tiny businesses. Interestingly, 2/3 of the effect is due to the lockdown, 1/5 of it to IO linkages, and that leaves a very minor role for demand effects and other factors that are considered in our model. I think this is interesting because it contrasts sharply with what the literature has found, for instance, for the US and other countries where lockdowns were imposed after the fact, after the demand was reacting. Our model does well in explaining cross-sectoral variance of the lost work hours. It explains 64% of that cross-sectoral variance. Lockdowns and informality explain the most within the factors that we measure. These, you can think of this exercise as a variance decomposition. And the numbers in terms of losses were indeed large, even though our model does not consider policy responses. 36% of active jobs were lost in that second quarter, when we were expecting that 50% of them were exposed. So that's a large fraction of the exposed jobs that were actually lost. So let me briefly talk about the model. This is, as I said, a very simple framework designed to be easily implementable for diagnosis. It's basically a framework where we try to measure the probability that a worker with a job that I index by I in a sector that I index by S loses a job in a scenario that I index by T. And this is the joint probability of the occurrence of a shock that hits the sector, and I'll talk about how we measure that, or intermediated by attenuating factors. The probability of working from home is one such attenuating factor. The probability that for some reason, even though the worker is exposed, he is not laid off or does not loses his or her job otherwise, is captured here by pi-it. When we take this to the data, we are thinking these of from the perspective of things that make employers and employees more or less vulnerable. And here is where firm size and informality enter. Informal workers are not covered by employment protection legislation, which in many cases didn't allow some of the employers to permanently lay off or even temporarily lay off workers. Jobs in very small firms also are more exposed. It's easy to think of smaller firms that had to shut down basically because they did not have the cash flow or the access to credit to survive the contraction of their sales. Now we translate these into aggregate numbers of losses by aggregating using a Kinchen multiplier. And of course, there is going to be something that we don't measure, policy responses, and anything else that is not considered in our model. So these jobs at risk, that is to say, everything we measure, including the Kinchen multiplier, is our object of interest. In terms of what is this probability of being hit by the shock, which depends on the sector you're in, it will depend on whether your sector is ordered to shut down on-site activities, whether the sector or the extent to which the sector loses demand, and these IO linkages, which basically consider these joint probabilities in downstream or upstream sectors of facing lockdowns or demand losses mediated by the input-output linkages. As I said, we implement this for Colombia, which indeed experienced a lockdown from March to September, which was imposed very early when we had, I think it's actually below 100 cases. The first peak came much later in July. We use data from the Colombian Household Survey, which reports for individuals who is self-employed, their informality status, the size of the firm they work at, and their occupation. You should think of this informality as labor informality. In particular, we measure it from contributions to pensions. If the person does not contribute to pensions, we consider him or her informal. And this is monthly information, which we use from 2019 to September 20, that is to say, the period of the lockdown. We measure this lockdown depending on whether you are in a non-essential sector. We use the IO matrix for our linkages. And the demand loss is measured as that implied by the output loss for the sector in Sweden, backed out from our model. So we observe the actual losses in Sweden for output and for jobs, and we pass those losses through this structure here using an IO matrix that's adequate for Sweden, and using the other elements of the model as structured for Sweden, and backed out what would be this demand loss. And that's, of course, because Sweden did not impose a lockdown. We calculate these probabilities of whether the occupation of the person is fit for work using the same data. And our scenarios depend for how exposed is this job depend, as I was saying, on this informality status and the size of the firm. We think let's just focus on this very first scenario where we say basically that everyone who's informal in a tiny micro establishment or firm is exposed. There is a third. This last thing here should be T equal to 3, I'm sorry. This third scenario is something we think of as the recovery, where small businesses are still exposed, but where the low need for organizational capital, the low entry costs, etc., allow formal employment recovery more easily than in other sectors. And our Kinchen multiplier is adapted to income levels. So let me show you quickly the results. The bars here, let's focus on scenario 1 and scenario 3. As I said, for Colombia, the exposed firms or jobs, sorry, given the structure that I showed you, go close to 50% of the jobs. If we take the Colombian data and impose the US structure in terms of prevalence of small business employment, sectoral composition, informality prevalence, etc., by reweighting the observations in the Colombian household survey, that risk goes down from 50% to 8.1%. If you think of a recovery phase where it is formality that's hardest hit in small businesses, then the things would turn around. The US would be more exposed, and that only makes us recall the fact that it is informality, as also shown here, that is driving the exposure. In the interest of time, let me just say that we
have 5 minutes, Marcela.
Yeah. So we reproduce this for value added, of course, because these jobs are low income, low value, then our results for value added show less exposure in terms of value added than jobs in these initial phases of the crisis. Just as a robustness, we ran this with the household survey for Peru, and you can see that the numbers are actually very similar to the ones that we find for Colombia. That's not surprising given how similar the two structures are. Now, in terms of the role of these different shocks, we evaluate that by reproducing the calculations, shutting down one of our shocks at a time, and assessing by how much the projected jobs at risk fall, and this is mostly driven by large by the lockdown scenario. We also implement other simulations of lockdowns when we do that partial lockdown, more similar to what happened in particular in Colombia towards the third into the fourth quarter of the year. Then of course vulnerability is much reduced. Interestingly, the relative importance of demand shocks and also their absolute importance goes up, but still if we follow whatever happened in Sweden in terms of how the demand reacted, then it looks that in absence of lockdowns and similar measures, the demand also reacts sufficiently little that this does not drive the results. The linkages do play an important role, and that is important because it tells us how much in general equilibrium we need to think when imposing these measures and thinking of measures to mitigate the effects. Let me now move to the actual losses. As I said, the job loss was large, 36%. Something similar in income. The lighter bars are for the third quarter. Most of it was indeed concentrated or in informal jobs compared to formal jobs. If you go to the third quarter, then you see that there's still large effects, but the difference between formality and informality has fallen importantly. And if you continue, let me show you also things further into the future, you see that the losses in the formal sector are hardly recovered from, say, October onwards. There is very little recovery even into today, which is important, I think, in terms of implications for the longer run. Something similar can be said about jobs at small firms. And of course, the effect was concentrated mostly in non-essential sectors, which is not surprising given how important we find that these lockdowns are. When we do this variance decomposition, as I said, 64% of the second quarter losses is captured and 43% for income losses in terms of the cross-sectoral variability. It is the lockdown or whether the sector is non-essential or not that explains most of the variability, and also how prevalent is informality. So I won't summarize again the results. I just presented them and summarized them at the beginning, but let me end by saying, of course, that what this shows us is that high informality and the prevalence of micro enterprises, which we know have different consequences in terms of inequality in other structural problems of Latin America, are also factors that make us more vulnerable to crisis. The COVID crisis is one example. It need not be unique in the sense that many of the characteristics that make informal and micro enterprise jobs vulnerable are not there only because of the nature of this particular crisis. The lockdowns seem to be costly more than would be inferred by evidence from other countries that imposed lockdowns later after the disease had hit, and this is so in a context with low capacity to mitigate via subsidies to jobs and jobless people. It is also crucial to think of what this implies for the future and for a sustainable recovery, and one that is inclusive. I think this signals a very stark concern about whether the recovery is going to deepen inequality in a permanent way. If we continue to be unable to recover, in particular, formal jobs, which are not only higher wage, but also generate more linkages and more organizational capabilities, as I was mentioning before, than informal jobs. And so it seems crucial to follow advice by several organisms to adopt quickly the reforms to the labor market that will allow us to get rid or at least mitigate the factors that not only lead to informality, but also make it so hard to recover the formal sector. Thank you very much.
All right. Thank you, Marcela. Actually, I have a few questions, but for the sake of time, and I'm sure the audience as well, we can use a chat in principle. But just for the sake of time, let's move on the next presentation. Nora, good to have you. Good to see you. The screen is yours.
Same here. Thank you very much. A pleasure to be here. And in fact, I'm pleased that we are a contributed session so that people can participate freely. Hopefully we have a little bit of time for some discussion. And so what I'm going to present today actually is not just one paper. It's a couple of papers and work that we've been doing with my collaborators on the impacts of COVID-19, both in terms of the short and long run distribution impact. And this is joint work with Guido, who's here, Mariano Tomasi, Stephen Younger, and my students, Valentina Martinez and Federico Sanz. So this, I want to first place the work that we're doing within the broader agenda, which is the impact of systemic shocks, such as economic crises, natural disasters, civil strife, and pandemics, epidemics, climate change more generally, actually, on inequality and poverty in the short term. We know that from the research that exists, these systemic shocks can be the single cause that produces the sharpest increases in inequality and poverty in the short term, and particularly in poverty. Inequality is not always moving in the same direction. But also what we have found over the years that it has lasting effect through their impact on human capital, particularly human capital of children, primarily through the channels of lower levels of health and nutrition and lower levels of cognitive skills and education. And I think, if you look at the literature, probably the first ones who emphasized this a lot was the famous book, Adjustment with the Human Face, that was published in the 80s by Cornea, Jolly, and Francis Stewart as part of the UNICEF response to the IMF austerity programs and what they meant for people on the ground. So given that you have the short-term effects that are quite large, but also the fact that there's persistence, and maybe as Marcela was showing, there is some hysteresis probably in some of what's happening when you have a systemic shock. The importance of mitigation and policies that also can help remediate become crucial, both in the social protection agenda and also in the education and health policies as well, in health and nutrition. Now, the pandemic is a multidimensional shock. It affects it has an economic crisis component, it has obviously the health crisis component, but also it has an education crisis component. So one difference that is happening, I think, in the pandemic is that, for example, as when we looked at the impact of the economic crisis in the longer run, we usually focus on, can you see my cursor, on how incomes affect human capital more on the demand side, because children are pulled out of school or parents cannot provide the nutritious food that they were able to do before, or they don't take them to healthcare facilities. But now we also have the supply shock, and that school closures entail, that also affect human capital directly, because schools are not there, and the replacement of formal schooling by homeschooling and other forms of schooling is less than perfect. So in any event, we know that the impact in Latin America of the pandemic has been very large on the three dimensions: the health, the economic, and the educational one. I show some of the data that we already have. So the work that we've been doing is trying to sort of estimate the effects, like I said, in the short term on inequality and poverty, and in the longer term, the effect of school closures on particularly educational mobility. And today I'm going to show you results for one of the dimensions, which is high school completion rates for children of different family backgrounds. So the first one is this section, which I'm going to focus on the short-term effects. And this is based on a paper that's about to be published in Economia. And the key questions is, what's the potential effect? It's also, by the way, we're using microsimulation for both analyses with different type of data and different models in terms of how we microsimulate. But that's that's the methodology that we have applied. And the key questions in this short-term effect analysis is, what is the potential impact of the COVID-19? Who are the biggest losers? And to what extent does expanded social assistance compensate, mitigate the negative effects? So we have here a non-behavioral microsimulation methodology, and I'm going to show you results for the largest countries in Latin America, which is included in this paper. And we also have other people that have done analysis for 3 of the Central American countries. The main findings are that without expanded social assistance, the impact is large, not surprisingly, particularly on poverty. And also, but what we found is that social assistance measures are able to mitigate, and sometimes the effect can be very large. It's very heterogeneous, and it depends on what the countries actually did. The simulation that we use is that we first identify the sectors that are at risk and those that are not at risk, using the information that comes primarily from the country's lockdown policies or ILO. And our data is household surveys, their income surveys in the context of these 4 countries. And we update them to 2019 to have the possibility of predicting what happened in 2020. That's our short term. To these using the information from the household surveys that I showed there. So the first thing is to estimate what is the distribution of income by income components, where I show you here the graphs have the households ranked by gross per capita income in the pre-shock situation. What's the composition of their income? And here what to note is that the dark blue is the income at risk. And see that it has a U shape. And the U shape is primarily driven by the fact that you have the orange. And the orange is the cash transfer programs that are so common now in Latin America, which provide a floor for the very, very poor. The vertical lines are the first one, the 550 per day in PPP. The dashed line is the national poverty lines. And the other 2 lines, you could say, divide the lower middle class from the upper middle class and the rich. So that's what we show here. And the interesting thing is this U shape, which is actually going to drive the results in terms of who the biggest losers are. And the way we proceed is because, I mean, this is a tool that can be used very easily ex ante before, when you have a big shock. What do you do to assess what could be the effect? That was our interest. And in fact, we started working on this because International Growth Center was interested to give information to the Ugandan government about who would be affected and if they could compensate people with some expansion of their cash transfer programs. And since this we started doing it in April 2020, very little actual information was available. So what we did is essentially, we calculate within the at-risk income, so the share of households with at-risk income that lose income and the share of at-risk income lost for those losing income. And you produce a matrix that, if only 10% of the households lose income and lose 10% of their income, then the aggregate loss in gross income would be 0.3%. The other extreme, if it's 100, would be 26%. And we choose the cases in which the total loss is similar to what the aggregate macro predictions say. And within those, we choose the one that high frequency information has now given us in terms of the percentage of households that have reported loss and what the losses are. These are the expanded social assistance forms that we included. They're not exhaustive, but we included the most important ones. And let me just move to the results. So the first thing to note is that without the expanded social assistance, which is the first dark blue bar, the light blue is ex ante, the dark blue first one is exposed, and the second dark blue is exposed with expanded social assistance. Increasing inequality could have been quite high, and that mitigation policies, particularly in Brazil, not only reduce inequality, but reduce it even more than what it was in the pre-COVID. And this is a result that now everybody has been finding because the expansion was so big. On the other hand, you have Mexico, which didn't introduce any expanded social assistance, so there's no exposed. After social assistance, it's only exposed without it, and this is the increase in inequality. More importantly, the increase in poverty, the blue ones here are the national poverty lines, the orange are the 550 for the 4 countries, so that the orange are the comparative across countries, the blue are not because each country has a different national poverty line. But again, what you can see is that the effect of the impact of COVID is quite significant, and in the countries where the social assistance was big, the impact in terms of containing it was important. And again, in Brazil, poverty may have ended up being lower in 2020 than it was before the pandemic because of the huge amount that the Brazilian government spent. In terms of the distribution of losses, you already saw by the composition of income at risk, you could have guessed what would have happened, but look at the red solid lines. They also look like an inverted U. And this is a non-anonymous growth incidence curve. So we fix the distribution of gross per capita income in the pre-COVID, and we see what the shock would have been without social assistance, the solid. It's an inverted U, meaning that the biggest losers are in the middle deciles. And then we add the impact of social assistance. And as you can see, in Brazil was huge. It goes, I think, to the 6th or 7th decile. I can see now because I see your pictures instead of my graph. In the case of Argentina, it covers the poor measured with the 550 line, which is the solid line. In the case of Colombia, it covers some of the poor. And in the case of Mexico, there's no effect. So the summary of key results is that it expanded on social assistance and the negative effects would have been very large. The biggest losses are not among the poorest, even though I have to say that small losses for the poor can signify much more because they're closer to subsistence, but relatively the ones that lose the most are in the middle deciles, where the moderate poor and also the vulnerable to become poor as a result of the shock. Expanded social assistance had potentially large fiscal effects in terms of compensating, in the case of Brazil, less so in Argentina, less so in Colombia, nil in Mexico. And as you can see, because of the slope of the what happens to the growth incidence curves, with the social assistance was pro poor, shown by the downward slope. Now let me move to the intergenerational mobility of education as part of the long-term effects on human capital. And here, what we argue is that, as economies begin to recover, the short-term impact, at least in part, on inequality and poverty is likely to reverse. But for the poor, however, particularly poor children, there may be long-lasting impact as a result of the school closures, because those children may be hurt disproportionately. And what we want to emphasize, we're not measuring everything yet, but that's in the plan of the next research stage, is this could lead to lower intergenerational mobility beyond education, future higher inequality of opportunity, and also future higher wage inequality, depending on the extent of the scale of this effect. So in Latin America, we had witnessed over time that the gap in terms of high school completion between children of low education parents and children with higher educated parents was narrowing. So the question is, what happened now as a result of what could happen as a result of the pandemic? Will this narrowing trend decline, disappear, and we start see a growth, and by how much? And so that's one of the things that we're estimating in our paper, which was published in the Journal of Economic Inequality as part of a special issue on COVID, and of which Guido Neidhofer is the lead author. So the key questions is the gap in high school completion rates likely to worsen? By how much? Have public policies been able to mitigate this? We simulate the effects of instructional losses using a counterfactual, and the main findings is that mitigation policies are weakly able to reduce instructional losses for children of low educated parents, and the likelihood for these children to complete high school, to complete a secondary degree, could fall substantially. The methodology is we do a counterfactual exercise to nowcast the effects. We use the data from Latino Barometro, which has harmonized recent data for 18 Latin American countries, all Latin America and the Dominican Republic. And defining our data, it ends up with over 10,000 individuals. So we collect data on information, very detailed data on school closures and policies to support this, calculate the instructional losses as a result of the fact of the school closures, and taking into account the mitigation policies, but also very importantly, taking into account the ability of parents to replace formal schooling with their own intervention, and that we make that a function of the education of parents. So the question that we ask is, what if past cohorts would have experienced the shock that the pandemic means today, and we estimate what that impact is on school closures. And essentially, to put it very so succinctly, we calculate an actual new instructional, an actual new variable of education, which would be equal to a normal year minus what is reduced as a result of the ability of parents to substitute formal schooling, and also instructional laws associated with the policies that governments implement in terms of both days of schools closed, mitigation strategies, and also how the outbreak may have affected other aspects of the household, like income or disease or death of members of the family. And so if parents have...
Sorry to interrupt, you have 5 minutes.
Yeah, if parents have had tertiary school, then they would have been able to substitute 100%. So this would be 0, and therefore schooling will be exactly the same as it would have been with a normal year. If parents are illiterate, they would have not been able to substitute at all. So the loss is very large. And in between, you have the whole array depending on the levels of education. So let me jump to the couple of things that I wanted to show you here. Whoops. This is internet access. And this is, an estimate of how all the things, this is a kappa, the average kappa, which is the amount of school losses actually experienced by children of low and high educated parents. And I'm showing here Brazil and Mexico. You can see disadvantaged children's loss of schooling measured with all the variables that we incorporate is so much higher than for advantaged children. That is what drives the results at the end. So what are the results? The results are the likelihood to complete high school, which the reds refer to children of low educated parents, and the green to high educated parents. The light version of the red and the green refers to the pre-pandemic. The dark version is the post-pandemic. And as you can see, the gap has been rising in all countries. So what does it mean in the end? Our question was, how is this going to affect the difference in high school completion rates between the two, between low and high educated, children of low and high educated parents? And what we find is that the increase is going to, well, the deterioration is there for both the high educated and the low educated, but for the high educated is rather small, for the low educated is pretty large. And the bottom line is that for the children of low educated parents, the average could be a drop from 52 to 32%, so 20 percentage points, which is pretty large. And that this low educational attainment was not seen for disadvantaged children since the 1960s. The cohort would bring you here, which is the 1960s. So we could go backward decades. For the difference could be, according to our estimation, could increase by 15 percentage points between the two groups. So the point is that COVID-19 could really reverse gains in social mobility and create inequality of opportunity and outcomes. And that's why, the same as Marcela emphasized on her end about what policies, the urgency of policies to avoid the rise in informality, here we emphasize the urgency of policies to actually remediate these effects so that the gap between children of low and high educated parents does not increase as much as our predictions show. Thank you.
Thanks, Nora. Scary and sad at the same time. Yeah. All right. So let's move on. Fernando, good to see you.
Great. Can you guys hear me okay?
Absolutely, it's fine. Thanks.
Okay, great. Thank you, Sergio, and thank you to the LaSalle Labor Network for organizing, and thank you so much for including me in the program. So I'll be presenting something that's related to what we have talked about and very relevant during the pandemic, as we're having this meeting over Zoom instead of in a beautiful Bogota. So today, quickly, in the next 20 minutes, I'll be talking about our paper entitled Working from Home in Developing Countries, co-authored with Marcus, Charles, and Jan at various universities. So the motivation for our work here follows from the fact that most countries across the world have implemented various policies to tame the spread of COVID-19. So most of these policies that are now varying in strength across various contexts generally encompass ideas of social distancing, which lead to the prevalence or the increase of alternative work arrangements, in particular working from home, as well as sectoral lockdowns that a lot of sectors were directly shut down at the peak of the pandemic. And this is also varied across context. So while these sectors were shut down, the ability of the economy to recover would depend on the prevalence, the likelihood, or the ability of workers to be able to work from home. So within this, prior to the COVID shock taking place, there was a lack of a historical precedent on the ability or on the ability to measure workers' ability to work from home. And within this analysis, previous work prior to our paper had largely measured workers' capacity to work from home, depending on task content that came from occupational dictionaries in developed countries. And as most of the audience hopefully can know or can understand, the tasks that workers perform in developing countries might differ substantially from the types of tasks that workers perform in developed countries. So one example is that maybe managers in developing countries use email differently than managers in developed countries, and there might be variation in terms of the types of tasks that workers perform across different contexts. So as broad motivation for analysis, I'll be showing you some time series evidence regarding the prevalence of working from home using data from Chile's Encuesta Nacional de Empleo from 2010 through 2021. So as you will see in this graph, it'll become very evident when the prevalence of work from home really ramped up and how heterogeneous it was across occupations. So here we're looking at the share of workers who are working from home and how this varies across different 9 different one-digit occupation groups. And as we see is that prior to COVID taking place in March 2020, the prevalence of work from home was very low. And then once COVID started taking place in March 2020, the prevalence of working from home really shot up, in particular for professionals and for managers, with subsequent variation moving forward. Then in other occupations, such as plant workers or workers in elementary occupations, there's almost been a negligible share of workers who are able to work from home. Another thing that you will hopefully notice from this is that the share of, for instance, professionals working from home reached all the way up to 55% in the peak of the pandemic and has declined since. So something that we will do in this paper that I think still holds important relevance moving forward, despite possibly the strength of COVID varying, is that there's still an open question as to which of these measures of working from home is the relevant one we should consider moving forward. Here we see that actual work from home might depend on conditions, so there's still a role for actually capturing well workers' ability to work from home. And then related to the topic of this session, inequality in COVID-19, we also see that the heterogeneity of workers' capacity to work from home largely depends on both their occupations, and as we will see in the following graph, it also largely depends on their educational attainment. So here we, for instance, see that the share of workers who are able to work from home in Chile in the past 11 years was almost 0 for high school dropouts. It increased slightly for people who graduated high school, and it really shot up close to up to 30% for people who had gone beyond high school. And I'm sure if we separated this out further into additional educational categories, we would see more heterogeneity, possibly with college graduates and postgraduates working much higher shares from home during the pandemic. So within this, what I'll show you over the next few minutes is that in this paper, we will be studying the ability of individuals to work from home. In particular, and this is very relevant to the Latin American context, we'll be using information regarding the task content of jobs and worker characteristics directly in developing countries. So here we will not be extrapolating our analysis from occupational dictionaries or occupational compositions in developed countries, but we will instead be focusing on developing countries to begin with. We will propose a measure of workers' ability to work from home, and we will assess the extent to which its ability may vary across countries. The second thing that I'll do is that I'll use data during the pandemic, so employment surveys from Brazil, Costa Rica, and Peru, to actually assess the extent to which our predicted measure of work from home actually correlates with workers' likelihood of having worked from home, and additionally try to understand, using the longitudinal component of Peru's employment survey, whether workers who had a higher ability to work from home were less likely to have lost their employment during the pandemic. And so that is the information we'll be taking advantage of within the Peruvian context. So within this framework, our two main contributions will lie in the fact that our measure of work from home will allow us to assess within occupation heterogeneity in workers' abilities to work from home. This follows from the idea that the tasks that workers perform may vary even within occupations. That is, not all managers might perform the same set of tasks. So if we want to better understand how COVID will end up leading to heterogeneous impacts in terms of inequality within the region, going beyond occupations and looking at within occupation differences might hold important relevance. Moreover, the share of workers who can work from home will be substantially lower than if we had based the analysis on US data, and then we will validate this insight. So as I mentioned before, our index is going to be very predictive of workers' actual ability to have worked from home during the pandemic and the likelihood of staying employed during the pandemic. So then there's a website to which we assess countries' abilities to work from home. We allow for heterogeneity in education. So if you want to take a look, feel free to click on this link. Hopefully it's still working all right, but this allows us to actually examine the extent to which COVID will lead to heterogeneous impacts across workers' characteristics and their occupation types. So let me now tell you a little bit about our analysis or our measure of work from home. So we'll be taking advantage of this really nice cross-sectional survey that was carried out by the World Bank called the Skills Towards Employability and Productivity. So a STEP survey that was carried out in 2012-2013. The survey covered workers across a wide range of countries that were mostly low and middle income countries. So the two relevant countries in the region are Bolivia and Colombia, but then we see that there's like cross-region heterogeneity. So we also have information on workers covering 2 African countries, some East Asian countries, so on and so forth. And we'll be covering a range, or this survey will be covering a range of workers in countries whose GDP per capita will range between 4,000 and 15,000. So here, once again, we're looking mostly at workers in low and middle income countries. So within this, we'll be looking at 18,000 workers who are largely evenly split across countries. So in each of these data sets, we observe about 1,500 workers, and these samples will be directly representative workers in urban areas. So one important advantage of this sample is that not only will we observe extensive information on workers' individual characteristics, as well as their labor market status, such as their occupation, industry, whether they're self-employed or informal, and their labor market outcomes, including their wages, but the essential element within this framework is that we can directly observe individual level measures of the tasks they're performing at work. So this is rare in the data, and this is going to be very important for us to measure workers' ability to work from home, because the fact that we observe individual level information on the tasks performed at work allows us to capture this within occupation heterogeneity that I had been talking about earlier. And I will show you the importance of this dimension of the data and of our analysis in just a few slides. So taking advantage of this STEP data, we're going to leverage the information regarding workers' task contents to develop a measure of these workers' ability to work from home. What we're going to do as part of this approach is to use a task exclusion approach in which we will consider that we will predict that workers are unable to work from home if these workers are performing any of the following tasks. So these tasks are likely to be very hard for workers to be able to carry out from their houses directly. So for instance, these tasks encompass whether workers are repairing machinery at work, operating industrial equipment, whether they report to have a physically demanding job, whether they don't use email at work. It's probably very hard to shift your activities towards working from home if you're not using email, or if you work in a job in which directly interfacing with customers is very important. And in the paper, we show a lot of robustness and to these different task exclusion measures, but this is a fairly robust measure in which we can capture the extent to which workers can work from home. So using this measure of workers' ability to work from home, we will first assess the extent to which workers in the STEP data have heterogeneous predicted capacities to work from home. So here what you will see is our predicted share of workers in each of these one-digit occupations who can work from home, as well as heterogeneity across important dimensions that also capture within occupation heterogeneity. So maybe to guide you through some of these numbers, let's first look here. Within the STEP sample, we predict that about 9% of workers would be able to work from home. And then we see here in the first column important heterogeneity across occupations. So Our measure predicts that about 24% of managers will be able to work from home, about 20% of professionals will be able to work from home, but these shares are pretty much close to zero for workers in these typically blue-collar occupations. Importantly, what we see here is that within these one-digit occupations, there's still important heterogeneity across workers' educational attainment. So a manager who's a high school dropout has a much lower predicted likelihood of being able to work from home than a manager who's a high school graduate. The reason for this is that the types of tasks that these workers are performing are significantly different, such that managers who are high school dropouts perform a much lower share of these non-routine based tasks that are more likely to be shifted towards home production. The same is true across differences between wage employees and self-employed workers, and there's also interesting differences across a gender dimension. So in theory, this measure would indicate that women would have had a higher predicted share of being able to work from home, with the idea that women tend to perform more non-routine, interpersonal, non-routine analytic tasks in the way at work. So the second dimension that we're going to do is to then estimate a regression in which we will seek to assess the extent to which workers' predicted ability to work from home depends on their observed characteristics, their occupations of employment, and their country fixed effects. So the country fixed effects here allow us to examine the extent to which there are underlying differences in countries' capacities to actually work from home, irrespective of their occupational compositions and of their observed characteristics. So we will just run a straightforward regression to try to assess the relative importance of all of these components. And the first thing that I'll show you is evidence from the regression. Then we can look at a variance decomposition. So first, what we see here in this straightforward OLS specification, in a specification which we don't control for occupation, we find that workers with higher educational attainment are more likely to be able to work from home, as are wage employees and as are women. Once we control for one-digit occupations, we still see that workers within those one-digit occupations who have higher education have a higher predictive ability to work from home, as do wage employees and as to women still. And even within three-digit occupations, we still see strong predictive power of educational attainment and of wage employment on workers' ability to work from home. The reason why this is important in a methodological sense is that if you use the ONET data to measure workers' ability to work from home, the only heterogeneity that you would be able to pick up is at the occupation level and not at the within occupation level. So here we're seeking to highlight that this within occupation heterogeneity is important for predicting the workers' ability to work from home. And this probably relates to the idea that tasks within an occupation are an important source of heterogeneity in labor market composition and in labor market outcomes, all in all. So then we will carry out this analysis where we assess the cross-country heterogeneity in workers' ability to work from home. And unsurprisingly, we're finding a positive elasticity between a country's GDP per capita and the estimated WFH ability. So we see that these higher income countries have a higher predicted ability to work from home. And then the related question that I mentioned before is, what are the drivers of these differences? Is it because these countries have different occupational composition, different observed characteristics, or is there some unobserved characteristic of these countries that drive the heterogeneous ability to work from home? So to do so, we will carry out the standard variance decomposition, and maybe we can focus on the second column since I'm a little short on time. And what we will see in this variance decomposition is that three-digit occupations will explain an important share of the ability to work from home across countries. The country fixed effects explain a very, very small share. And importantly, we see a positive covariance between observed characteristics and occupation fixed effects. So this is indicating that within each occupation, accounting for these worker observables, such as their educational attainment, is once again an important predictor of WFH. And the fact that these country fixed effects play such a small role in the variance decomposition indicate that we can comfortably extrapolate our analysis to a set of countries that's covered within the range of STEP countries. The reason why we believe our measure is very important for developing countries is that if you instead used information coming from the ONET, which captures the workers' task composition in the US, you will end up with a very different picture of what you think workers could actually do from home in developing countries. In particular, here we compare the estimated predicted work from home share if we used ONET data. These are three-digit level occupations. So here on the x-axis, you have our predicted work from home share using ONET data, and on the y-axis, you have the comparatively predicted work from home share using ONET data. And what we see here is that for 93% of occupations, you would get a much higher predicted work from home share using ONET data, that is using information on workers in developed countries, than you would using STEP data. So then it's an empirical question as to which of these two measures is most predictive for the share of workers who are actually able to work from home during the pandemic. And once again, let me highlight that this difference is coming from the fact that workers in developing countries tend to perform a much lower share of these non-routine tasks or of the types of tasks that could be done from home, even within these 3 digit occupations. That is the main source of these differences. So we believe our measure holds a lot of value in that. So then to validate our measure, we will be taking advantage of these employment surveys that were carried out in Brazil and Costa Rica during the pandemic. And the really nice thing about these 2 surveys is that they directly asked workers information regarding whether they were working from home or not. And thus we can crosswalk this information of who was able to work from home during the pandemic, additionally with workers' occupations, their worker individual characteristics, and this will allow us to compare our predicted work from home measure that we had from the step data to workers' actual ability to work from home. And then lastly, we'll do something similar using the Peruvian data. So first, let me quickly tell you about this data. So in Brazil, the PNAGI COVID-19 was carried out between May and June 2020. It's been extended out since. And in Costa Rica, we'll be looking at information coming from Costa Rica's Encuesta Continua de Empleo. That we will be using information from the second quarter of 2020, so right as the pandemic was happening. And we will be using a similar sample restriction that we did for the STEP survey. So mostly looking at urban workers or prime age workers. So in Costa Rica, we will now look at the prevalence of workers in Brazil, we're looking at the share of workers who are actually able to work from home during 2020. And we see it on average about 13% of the PNAGI sample was working from home in the second quarter of 2020. And we importantly see similar heterogeneity to what we predicted with our measure. So we see that a large share of managers and professionals and technicians and clerical support workers are able to work from home, whereas almost a negligible share of those in blue-collar occupations were able to do so. So these workers were much more likely to be shielded from being exposed to COVID-19 during the pandemic because they were able to shift their production towards home. Once again, the important dimension of within occupation heterogeneity emerges here, as we only saw that about 1% of high school dropouts were able to work from home during the pandemic in Brazil, compared to about 18% of those who are high school graduates or beyond. And additionally, this heterogeneity also shows up within one-digit occupations. So managers who are high school dropouts had a much lower prevalence of working from home than high school graduates, as did self-employed workers compared to wage employees. And there's really interesting gender heterogeneity that I will not have much time to discuss here, but in theory, women had a higher capacity to work from home, and that seems to have been borne out in the data. This depends on the heterogeneous occupational composition across genders. In Costa Rica, we see similar information, though we have a much smaller sample size. So the next thing that we will do is to directly assess the extent to which these observed characteristics, as well as occupation characteristics, allow us to explain the workers' actual work from home outcomes during the pandemic. And as we have predicted using STEP data, we see that workers who had much higher education, who were wage employees, and those who were female had a much higher likelihood of being able to work from home during the pandemic, even conditioning on one-digit occupations in Brazil, and even conditioning on three-digit occupations in Costa Rica, as we had predicted using STEP data. So once again, the fact that our STEP data was allowing us to pick up this within occupation heterogeneity seems to have been borne out in the actual data, because this within occupation heterogeneity also emerged in workers' actual work from home outcomes during the pandemic. So the contribution of these workers' characteristics is very similar to what we would have predicted using our STEP data. And in fact, what we see here is a comparison of our predicted work from home share using the STEP data to the actual work from home share in Costa Rica at the 2- and at the 3-digit occupations. So hopefully, as you can clearly see from the graph, that our predicted work from home share and the actual work from home share are very highly correlated. If we instead did this prediction using ONET data, we would have gotten really incorrect answers in the sense that ONET would have over-predicted workers' actual work from home outcomes within our analysis. So in this setting, we additionally see similarly that the occupations or the types of workers who had a much higher predicted work from home likelihood were also much more likely to work from home. And this is true in both Brazil and in Costa Rica. So we validated our measure using actual work from home outcomes during the pandemic. And within this, we additionally, for each worker, we impute a predicted work from home share using our analysis in the STEP data, and then we compare how well this relates to workers' actual from home outcomes. I know I might have a minute or two left, so I'll try to.
You have three, Fernando.
3 minutes, pretty good. Okay, there's not 33 slides. This is including the appendix. So we additionally see that our measure well predicted workers' ability to work from home. And the last thing that I want to get through is how did this matter regarding which workers were actually able to keep their job during the pandemic. So here we nicely take advantage of the longitudinal component of Peru's Encuesta Permanente de Empleo, which has a longitudinal component tracking workers across a one-year panel. So here we can measure workers' employment outcomes in 2019. We observed their pre-COVID occupations, their pre-COVID characteristics, and therefore we had a predicted measure of these workers' ability to work from home using our step data. So we would look at 2019, we had a predicted measure of work from home, and then we compare the predicted measure to whether workers were able to keep their job during the height of the lockdown in Peru. So this is between April and November 2020. And what we see within this analysis, maybe let's focus on the first column first, is that workers who had a higher predicted work from home ability were much more likely to have kept their job during the pandemic. An interesting dimension emerges here is that we additionally directly control for the essential nature of the industry and workers in which workers were originally employed. So some industries remained open in Peru throughout the pandemic, and we see that in these sectors that were open, these workers were more likely to keep their job, and the extent to which work from home ability mattered was less prevalent in the sectors that were essential. So if your sector was essential, you're more likely to have kept your job, irrespective of whether you had a high or a low probability of working from home. And here we still see that our measure had very strong predictive power in terms of workers' ability to keep their job, even upon controlling for a strong set of observed characteristics. So all in all, what we have shown throughout this analysis is that our measure of the ability to work from home for workers was very predictive in terms of who was able to work from home and of workers' ability to keep their job. And I think the main reason why this measure is still valid, maybe going back to the first graph that I showed you using Chilean data, is that we see that the share of actual work from home is changing over time, but it's still unclear as to what the actual measure of future ability of workers to work from home and to shield themselves from possibly a future wave to COVID-19 is. So I think our measure will still hold a lot of value moving forward as the pandemic hopefully dwindles down. So I think we can wrap up with that, and hopefully I'm still on time, Sergio. Anyways, thank you for including my paper in this session.
Thank you, Fernando. Fantastic. Yep, you were on time. We're doing fine. We will probably have minus 2 minutes to comment at the end. We have a few minutes, hopefully. All right, Juliet. Good to see you.
Yes, thanks for the invitation. Let me share my screen. Let's see. Are you seeing the presentation?
Yep, we can see it.
Perfect.
You might, there you go. Perfect.
Okay. Thanks for the invitation. Today I'm going to present a paper co-authored with Daniela Aromi, Maria Paula Bonel from Universidad de Buenos Aires, Julián Cristian from the IDB, Martín Yada from also Universidad de Buenos Aires, Juan Ignacio Pereira from Brown University, Xiomara Pulido from British Columbia, and myself. So this was a very nice project to do at the beginning of the pandemic. We started this project around March or April. And what we study is how social distancing policies affected mobility in Latin American countries. So a little bit about the context. As we all know, when the COVID-19 pandemic started, the WHO and other institutions produced a series of recommendations for slowing the spread of the virus. Based on the science and the knowledge that we had at the time. These policies were implemented by different types of governments, and there were different types of policies the government implemented. So the objective of these policies was to control local transmission rates. And some of those measures that were taken by governments were lockdowns, school closings, closure of hospitals, and closure of bars, and restaurants, and cancellation of public events. And some of them are still in place, but these measures started. The first country that implemented a measure was on March 10th, so it was pretty early on the pandemic. The evidence that we have on how these measures affected mobility focus on developed countries. So we have the case of the US. We have some studies that have shown that mobility went down by 3 to 26%, depending on the study, on the geographic area they analyzed, and on time frame they analyzed. But we know very little about what happened in a context such as Latin America, where we observe high poverty rates, high informality levels that might have prevented work or workers and in general the population from staying at home. So what this paper aims to do is to quantify the impact of national social distancing policies on human mobility in 18 Latin American countries. We use, in summary, we use time variation and cross-country variation on the time, length, and implementation of policies that promoted social distancing between March 1st and April 14th. To compute mobility, we use georeference data from cellular phones. Although we do quite a large number of robustness checks, so our main methodology is to use a difference in differences model using a correction by Chess-Martin and Dot-Foy. And what we find is that lockdowns reduce mobility by 10 percentage points during 15 days after the implementation of the pandemic. And just for reference, that explains about 1/3 of the reduction in mobility during that time. These effects vanish quickly. So the effects after the second week of implementing the lockdown are 5 percentage points lower compared to the first week. And we also find that other measures had lower to no effect on mobility. In particular, we find that school closures have reduced mobility, but closures of bars or restaurants and cancellation of events did not have any effect on mobility. So a little bit about the data. In terms of how we collected the data on social distancing policies, our criteria were two. We included policies that aim at reducing local transmission, and that to reduce local transmission, reduce mobility. And that discarded airport closures, for example, because airport closures aim at reducing international transmission. And the second criteria was that the policies had to be implemented at the national level. So some countries some countries had policies implemented at the sub-regional level, and we did not take into account those cases. We collected information on 4 policies that met those criteria: lockdowns, school closings, closure of bars and restaurants, and cancellation of public events. And as I mentioned, we collected this information on 18 countries in Latin America. To summarize, what we found is that in March 2020, 11 countries implemented lockdowns. 11 countries out of the 18 countries we analyzed. 17 implemented school closings, 15 implemented bars and restaurant closings, and 17 implemented the cancellation of events. What this table is showing between columns 2 and 3 is the date in March when those policies were implemented. So policies were implemented as early as March 10th, and the policies that were implemented on March 10th with the closure of bars and restaurants and the cancellation of public events. But the first lockdown took place, as you can see on column 3, on March 16th. In terms of mobility, we observe information on the time and location of smartphones. We have aggregated data on that, which was provided by Veraset. What Veraset does was that it collects information on the apps installed in smartphones, and then it organizes the data, it aggregates the data. And what we observe is the latitude and longitude of a particular cell phone at a moment in time, which we are going to call a ping. And we observe the date and time, minutes and seconds of each ping. We aggregated this data and created a panel data set with daily information on the percentage of people traveling more than 1 kilometer per day per country between March 1st and March 14. Something it's worth highlighting is that number of pings collected in a day is usually positively correlated with a person's mobility. So we restricted the data so that we have enough observations per cell phone to compute this measure. What we see here, it's the number of observations from that data set in millions per country, and what that number of observations implies in terms of the coverage on the population. So the maximum we have is a coverage of 0.5 people in the data set per country. And we find that the mobility between March 5 and 11, which is before the first lockdown was implemented, was around 60 to 70%, which means about 60 to 70% of the people travel more than 1 kilometer per day. And okay, let's go to methodology. So as I said, our main specification uses a balance panel. We have one observation per country per day. We observe mobility and the time of implementation of the policy we analyze. In this case, I'm presenting the model of lockdowns. So in this case, we have mobility that represents the percentage of people traveling more than 1 kilometer. We control for country fixed effects, day fixed effects, and we use the time variation and the cross-country variation of the implementation of the model. One of the concerns of using a simple difference in differences model is that every treatment unit enter treatment at different points in time. To control for that, we use Chess-Martin and dot-foil unbiased estimator. And what we find is that lockdowns reduce mobility by 10 percentage points. To give this number of context, during the difference between the first in mobility between the first week of March and the first week of April was 35%. So that 35 percentage points. So this reduction accounts for 1/3 of the reduction in mobility. School closings, the effects are around cause a reduction of 4 percentage points, but the closure of bars and restaurants and the cancellation of public events did not change mobility. We control for the models that we have here, control for the fact that other policies were implemented at the same time. And we also do some robustness checks. One that it's so when these policies were implemented, it could have happened that the country implemented these policies because they were anticipating for bad shocks. So what this table is showing is two types of specifications. One in which we are controlling for the fact that lockdowns did not happen alone. There were other policies in place, and that's what the results of columns 2 and 5. And also we control for the number of new cases, which accounts for the fact that countries may have implemented these policies because of the bad shocks. We find that the effects are pretty stable in terms of lockdowns. The effects are close to 10 percentage points, and in terms of school closings, the effects are between 4 and 5 percentage points. We find again that in the case of bars and restaurants, there is no effect, and in the case of cancellation of public events, there are no effects either. We also we also explore dynamic effects to understand how these policies affected daily variation of mobility. So we use an event study where we interact, where we have variation on the moment the policy was implemented daily. This set of them is equal 1 for the R after the introduction of the lockdown in country I. We use 16 days before and after the implementation of lockdowns for every country. And again, in this case, we use the correction of Chess-Martin and Dufoil. And in summary, what we find is that two things are worth highlighting from this graph. First is that the treatment and comparison group are pretty similar in terms of mobility before the implementation of lockdowns. The x-axis is showing you the time to the lockdown implementation. And after implementation of lockdowns, mobility went down by about 10%. And something that we show in the regression results, but it's not, and starts to show a little bit on the graph, is that the reduction in mobility, the effects on reduction of mobility vanish after a certain time, or were reduced after the lockdown took place. So what this table shows is that post-lockdown reduction mobility decrease. The effect of day 0, it's around 10 percentage points. 1 week after the implementation of the lockdown, the effects were close to 12 percentage points. But then after the second week and later on, the reduced are half of the size of the effects of the first week. So the effects of lockdowns vanish pretty quickly in Latin America. And we also do heterogeneous effects by country. And to do that, we do 2 types of exercises. First, we compare mobility trends with averages of countries that did not implement a lockdown on the period of analysis, which are Chile, Costa Rica, Dominican Republic, Guatemala, Jamaica, Nicaragua, and Uruguay. And we also, as a robustness check, although I'm not showing it today, we use a synthetic control following Abadi et al. Methodology. And in summary, what we find is that different countries had different types of reactions to the lockdowns. This might be related to the fact that some countries were more harsh in terms of the implementation of the policies compared to others. So we have the case of Argentina and Ecuador and Bolivia as well, where mobility decreased a lot. And we have other cases such as El Salvador, Colombia, and Honduras, where mobility did not decrease as much as in the other countries. We have the same analysis for Paraguay. In Paraguay in particular, we find close to no effects between, or close to no difference between the treatment and comparison group, the treatment being the group that implemented, or the country that implemented the lockdown, and the comparison group, the group of 7 countries that we are using to compare this country with. So I think I'm right on time. The conclusions on implications of this paper is that, well, lockdowns reduce mobility by 10 percentage points. Remember that we, at the beginning, we started with the question whether lockdowns were effective to reduce mobility in a context with high levels of poverty and high levels of informality. And we find that yes, lockdowns reduce mobility by 10 percentage points, and that accounts for the reduction of mobility for 1/3 of the reduction of mobility in mobility in March. We find that the effect is 28% smaller in the second week after the lockdown relative to the first week. And that is indicative that these policies do not have long-term effects. and definitely are not free of uncertainty. There are some countries in which these policies work better than in others. So we have the case that Bolivia, Argentina, of Ecuador, which show the largest effects between 16 and 19 percentage point reduction, while Paraguay and Venezuela show the smallest effects with close to a 3 percentage point reduction. We also find that other policies, such as school closures, have a significant reduction in mobility, but the size of the effect is smaller. We found that the effect is around 4 percentage points on weekdays. I forgot to mention that in the case of school closures, we didn't use the mobility over the whole week, but only between Monday and Friday, but we also do a robustness check using mobility throughout the week. We find that the closure of bars and restaurants and the cancellation of public events had no statistically significant effect on mobility. And again, something that we have to highlight is that this paper finds that these effects in general vanish pretty quickly, at least in the region, compared to the evidence that we have from other countries. With that, thank you.
All right, thank you very much, Juliet. Any questions from the audience? We have a pretty stable number of people connected. Marcela, I see your hand up.
I just
Please go
wanted
ahead.
to ask Juliet, I'm a bit surprised by the numbers. So if I just look at Google Mobility and compare Colombia, Argentina, Peru against Mexico, Brazil, the differences, it depends on what activities you're looking at, but they range between 20% and 40%. I'm guessing that what you're calling mobility, it may be a pretty restrictive measure of mobility. So I was thinking, I mean, during months, we couldn't go beyond the supermarket here, but perhaps the supermarket is beyond 1 kilometer. Bogota is not a very efficient city. So I'm wondering how robust your results are to looking at other measures of other ways to look at mobility, just because they contrast so much with not only my life here, but also how the numbers that we see saying, yeah, again, in Google Mobility.
Right. So this measure, yes, I understand your point, because we also debated within the team whether the percentage of traveling more than 1 kilometer was an appropriate measure. We tried different types of specifications, and we also do some robustness checks using the Google Mobility data. And in terms of causal effects, we find results that are pretty similar, but probably I have some co-authors here that might also answer this question. We can definitely try other types of measures. We just try to simplify it for the sake of interpreting the results. But yes, we can take that comment. Definitely, we can try other measures. Thanks, Marcela.
Any other comments or questions? All right, so super interesting results. We're learning the impact of COVID, unfortunately, and also the needs of future data collecting efforts to actually, identify what happened. I think one of the challenges will be to identify sources of information that will allow us to really understand across different dimensions what happened. So let me thank again, Marcela, Nora, Fernando, and Juliet. Thank you for participating, for accepting the invitation, and hopefully next time we'll be in person. So if there are no other comments or questions, let's end now. Thanks again for participating. Thank you.
Thank you, Sergio.
Thank
Thanks
you.
for the invitation.
Good to see you all.
Good to see you.
Bye-bye.
Bye-bye.